We set up a panel at the Royal Marsden to look at an unfortunate case where a gentleman passed away at a local DGH, where it was thought that because he had cancer he was on the palliative pathway, and unfortunately he should have been treated actively. This gentleman had nobody to advocate for himself, and it resulted in us looking into initiatives that might help someone in such case in the future. So one of those things was a medical alert band. It's a simple rubber wristband, about £5 in cost, and we looked at the cost effectiveness of this compared to how the patients would receive it. So we see about 6,500 new cancer patients a year, and the cost obviously would work out about 33,000. So the first thing we needed to do was audit to see if the wristband would be of use and how it would be received by our patient population. Some of the results were mixed. I'd compare it a bit like Marmite. It wasn't everybody's cup of tea, which is how we envisaged it in the first instance. Some of the patient comments that came back, the positive side of things were that it gave them a level of security. Lots of people described it as a security blanket, offered them a higher level of confidence. Others said that it was uncomfortable, and they particularly thought it was offered no more than the alert card itself. So a really mixed response. Some particular patients wanted to wear it when they were out alone. Others felt it drew attention and was quite intrusive and an outward sign of their cancer. One particular lady recalled an event at Tesco's where she was approached, asked what it was about, and felt obliged to explain. So as I said, a bit like Marmite, but a mixed response. In conclusion, our patients will be offered these bands in a range of colours and sizes. What we will be assessing the patients on a individualised basis as to whether they would like them before we roll it out to all. We really want to find out patient preferences before we do so, which the audit helps us discover.